Decaf. I'm one of those with normal A1C, but my postprandial goes to 200s. If it's into the 200s, that fits the definition of diabetes. It's not just me saying that. Even the ADA, American Diabetes Association, ACC, American College of Cardiology, people agree with me. Over 200, you've got diabetes. But as soon as I eat and do some bicycling, my sugar immediately is down to 160. My doctor doesn't want me to start on metformin. You bring up two other really good points. Number one, over 200 is you fit the diagnosis for diabetes. And if your doctor doesn't want to give you metformin and you've got diabetes, I'd be concerned. I really would. Look it up on anywhere. And don't look it up with crazy internet docs like me. Look it up with the American Diabetes Association. Look it up with the American College of Endocrinologists, the American Association of Clinical Endocrinologists. Blood sugar over 200 anytime, not wanting to take metformin, that's a challenge. That's a problem. Now, you bring up another point. You go out cycling and it's immediately down to 160. Well, as we mentioned before, there's a lot of evidence that 160 is still causing damage. Another point to this is you go out cycling. One of the key things that I like to do with diabetes self-care is put a little button on the back of people's arms. That button is called a Freestyle Libre. It gives us our blood sugar values 24/7 for 2 weeks. They have some frustration with it sometimes. Most often it's because they're taking over a gram of vitamin C. Vitamin C actually messes up anything that's measuring the blood glucose. But let me go back. The people that do use these Libres and get some really good information out of it, there are 2 or 3 things that we typically see over and over again. I didn't know my blood sugar dropped so much at 2, 3, 4 in the morning, and it does. And blood pressure drops at 2, 3, 4 in the morning, right before it starts rising again. And that's been found to be healthy. Another thing that they find is my son wanted to go out and have pizza and beer. I don't usually do that, but I took a carb vacation. I had some pizza and half of a beer. I knew my blood sugar was going to go up. My son went out to walk with me, and we just did a gentle walk for 15 minutes. And the spike on my blood sugar, which I knew I was going to have, stopped. It went away. It just cut the head right off of that spike. So even just gentle walking, D, is enough to pull that sugar out of your bloodstream and into those hip, thigh, calf muscles as you're walking. So even gentle walking is a big, big deal for managing your blood sugar. It's like a safe endogenous shot of insulin. Muscles that are working actually bypass those failing insulin receptors. So you don't need an insulin receptor when your muscles are working. Speaking of which, and I can't help but go on about exercise and this issue, did you ever connect the dots that time and time again in terms of heart disease, we've seen that exercise helps? If you get a good major workout at least 3 times a week, it helps. Well, here's the thing. This insulin impact that you describe when you go bicycling, if it's big muscles and it's intense enough, it's been shown to impact blood sugar for up to 48 hours. 48 hours, 48 hours, 48 hours, and you've got a week. You've got 6 days there. So can't talk enough about lifestyle and managing this problem.